Measurement of hip flexion range of motion. The important aspect of measuring hip range of motion is knowing where the position of the pelvis is. When the hip is flexed, the pelvis begins to tilt posteriorly, flexing the lumbar spine. To create a standard for the position of the pelvis, palpate the PSIS, flex the hip until the PSIS begins to compress into your hand. At that position, we then can measure the angle of the femur with the horizontal, aligning the goniometer from the trochanter up to the lateral epicondyle and the stationary arm on the horizontal plane. AB and adduction range of motion. We're going to have the goniometer aligned with the two ASISs at the stationary arm. Then we're going to abduct the pelvis to achieve end range, keeping the hip in neutral. Align the goniometer across the ASISs and project the moving arm down through the middle aspect of the patella. Adduction, the landmarks are the same. Now we're going to adduct the hip until end range is achieved, and using the same alignment to get the angle of adduction. Hip internal and external rotation. For external rotation, we're going to bring the foot medially, stabilizing the distal femur, and then aligning the goniometer stationary arm being on the vertical, moving arm going from the patella, sighting down midway between the malleoli. Medial rotation, the alignment is the same. And immediately rotate. What's important here is to stop when the pelvis begins to tilt laterally, or another way is to have the patient rest some weight on their hand to help stabilize the pelvis. And the alignment is the same. Okay, the next is a modification of the Thomas test to assess the length of iliopsoas as well as the hip extension range of motion. I'm going to ask Kristen to grasp the distal aspect of her femur and help her to the supine position. From here, I need to position the pelvis so we know where the pelvis is when we take the hip into extension. So I'm going to flex the hip until the PSIS pushes down to the table. She's going to hold that position as well as I'm going to stabilize. Then we're going to take the leg that we're testing, cradle it with the knee slightly flexed, slowly lower it to the table until we see the pelvis begin to tilt anteriorly. Test the other side, simply switch legs, make sure the pelvis is positioned correctly. Bring the leg down until the pelvis just begins to move. Normal length, the femur would achieve a horizontal position. From the Thomas test position, you can also test the length of iliopsoas by letting the hip extend and allowing the knee to flex, or assessing the angle of hip flexion as well as knee flexion. Normal length would be the hip achieving 0 degrees of extension and the knee achieving 70 to 80 degrees of flexion. While doing the rectus femoris length test, you may find that the hip abducts. That would indicate that the TFL is tight. Next test is the Ober's test to assess the length of the tensor fasciae lata. Patient to test their left side is in right sideline with the right hip and knee flexed. Grasp the top leg coming around the anterior aspect of the tibia and femur. What's important here is we're attempting to take the IT band and place it up over the trochanter and then assess the length of it. The traditional Ober's test is done with the knee flexed to 90 degrees, so we're going to do it that way first. We're going to take the hip AB ducted, extend it all the time, stabilizing the pelvis, bring it to full extension to the pelvis just starts to tilt anteriorly, and then lower the leg carefully into adduction. Normal length would be 10 degrees of adduction before the pelvis tilts laterally. A modified version of this test is with the knee extended, with the same maneuvers are used. Again, attempting to take the IT band, place it over the trochanter, and assess its length. To assess the length of the hamstrings, we're going to use the straight leg raise maneuver. What we're doing here is, with the knee fully extended, flexing the hip, and to use a consistent position of the pelvis, once again, we're going to be palpating the PSIs to feel when it pushes into the table. At that point is where we're going to take our measurement of the angle relative to the horizontal of the femur. It should be roughly 80 degrees. Two methods of testing the length of the hamstrings. One is the straight leg raise. One of the limitations of the straight leg raise is you have excessive pelvic rotation when doing a straight leg raise. So the preferred method is the knee extension method with the hip flexed. So you flex the hip to 90 degrees so that the lateral epicondyle is perpendicular in line with the greater trochanter of the femur. Then you're going to stabilize the femur, and you're going to passively extend the knee. You have to ask the patient not to help me with this. And you extend until you reach R2, or that point of firm resistance. Then you hold that position and you align the goniometer with the femur and the shaft of the fibula. Measure knee range of motion using the supine position. The hip and knee are flexed to achieve the end range of flexion, at which time the goniometer is aligned with the stationary arm going from the greater trochanter of the femur down to the lateral epicondyle, and the moving arm along the shaft of the fibula from the fibular head to the lateral malleolus. This test is often described as being performed in the prone position. However, in the prone position with a tight rectus femoris, the muscle will limit the angle achieved by the knee if done in the prone position. Measuring knee extension or hyperextension, we're going to use the same landmarks as knee flexion. Note we have the roll under the distal tibia to allow the knee to fully extend, and then taking that angle.